So it's interesting because that person genetically maybe won the lottery and has a high resilience and ability to detoxify chemicals and things. But most of our patients are now living in this toxic world. And part of the reason why we're seeing an epidemic and why many of us have waiting lists for patients is because the toxic load is overloading their system. So I want to give you some clues on how to do that. Now, this list, believe it or not, is not exhaustive, but I wanted to give you a place to start as far as like what I would do in an office visit for most of my patients. So you want to look at the liver, the kidney, the blood counts, and specific liver markers like GGT, LDH, etc. You want to look at a complete thyroid panel, hormone panel, adrenal panel. So you look at their endocrine axis. And I include in those FSH, LH, ACTH, ADH, sometimes prolactin. So I'm including not only the hormones in the system, but the pituitary hormone. So you can see where in the axis there's a block, if there is a block. Homocysteine can be an important marker of methylated vitamin status and also risk of stroke and heart attack or inflammation or poor methylation. Iron panel ferritin can tell you all kinds of things about iron deficiency, iron overload, etc. Genetics, these are just a few that I do. I do the celiac genetics, I do the MTHFR, I often do ApoE4, the DR1345 HLA typing. That had been used for mold and risk categorization, but the original data that was put out was not valid. So I put less emphasis on that. I still absolutely believe and see the science behind that. Some people are more at risk and some people are less at risk. That is true. But to categorize them as dreaded or not dreaded, I don't think is a valid way to do that. Lipid peroxides can show if there's oxidative stress in the system, as well as 8-hydroxyD-guanine, which is a marker of DNA damage. If those are high on your organic acid test, you want to be looking for oxidative stress, whether it's chemicals or metals or other exposures. B12, folate, zinc, magnesium, selenium, copper, these are core and easy to get on any routine lab. I often do a full micronutrient panel, so those can be done as well. And then specific toxicant based on history. I don't always do a full toxicant panel because, again, with the bucket and the load, all you really need to know is that their toxic load is high. And then certainly different categories have different detox strategies. But if you're starting in the beginning, you might want to start with one thing and start to detoxify them. And you don't have to know every single last thing in the bucket in the beginning. Fatty acids can be helpful, cardiac cholesterol lipid panel with fractionations, lipoprotein little a, ApoE status, etc. ANA and ENA panels would be to check for autoimmunity. And of course, there's a lot more comprehensive predictive autoimmune panels if you want to go deeper on that. Stool analysis is critical to look at the gut and the microbiome. Urinary organic acids are always a part of my initial evaluation. Fasting glucose, insulin, adiponectin, leptin, and A1C to assess leptin resistance and metabolic syndrome. And then the markers for celiac disease. And I always check the immune system because I find a large percentage of people, whether it's due to Lyme, co-infections, mold, or genetics, they have an immune deficiency that they've been seeing doctors for years and no one has ever diagnosed. So that's really critical as well. And then checking for infections. Now tomorrow morning, we'll start off with all the infections, and I'm going to focus on viruses, but I'm actually going to run through a little bit of an overview of all the kinds of infections that we see, kind of to give you just an overview of how I look at that, what to do, and how to look at infections, because this can feel overwhelming. So these are just some of the ones that I would check for. I do a lot of viral titers. Viral titers that are 4 times the normal limits can be considered reactivated or positive. And there's a special way to look at Epstein-Barr, which I will talk about tomorrow.